Good day, I'm Daryl Scott. I'm a pediatric clinical geneticist. I work at Texas Children's Hospital, and I'm an associate professor at Baylor College of Medicine. In my clinic time, I mostly see pediatric patients who have genetic disorders or are thought to have genetic disorders. Most of them come to see me because they're trying to identify the cause of those disorders and then learn more about what that means for their family and for their future.
So our question is there ever a reason any child diagnosed with autism or a developmental delay should not be screened for genetic abnormalities?
Certainly one of the main reasons why children come to visit me with their parents in genetics clinic is to try to identify the cause of their autism, developmental delay, or intellectual disability. Most of those families are looking for particular answers. They want to know, for example, what the cause was, if this is something that might reoccur in a future child, or sometimes they also want to know whether when this child grows up and has their own children, might they also be affected. We also are very interested in trying to learn or determine whether a particular child might be at risk for some difficulty in their future. For example, there may be something medically that we can identify by having a molecular diagnosis, that we can identify through a genetic test that might help us to scoot around a potential problem that might occur in the future. And so there's many reasons why it's good to get genetic testing, especially if it's not known why a child has autism, developmental delay, or intellectual disability. Of course, every genetic test has a cost, and most genetic tests will require a blood draw. And so there is some cost to be paid for that information. Probably the number one reason why a child with autism, intellectual disability, or developmental delay should not get a genetic test would be if competent medical personnel have already determined the cause of this child's difficulties. In other words, if there's been a serious infection, if the child has gone through some important trauma, or there's some other reason to think that this is the cause, then perhaps it's not worth paying the money or taking the time or going through the pain of getting a genetic test, which is unlikely to reveal a new or different cause. However, even in cases where there might be some indication of why a child may be having some difficulty, it's not always completely sure. In those cases, it may be worthwhile to be seen by a clinical geneticist to determine if indeed there is some room for doubt and whether a genetic test may be able to shed greater light on a child's diagnosis.